Welcome back to News Center right here on KTN News with me, George Maringa. Thank you so much for staying with us. I want us to focus on something quite interesting, and that is the launch of the newborn sickle cell screening center at Jaramogi Odinga Teaching and Referral Hospital. Sada Hassan, our Health and Science reporter, is in studio with me and joins me for this discussion. Sada, good morning. Talk to me about this launch and what it specifically means, not only for that part of the country, but also the rest of the country.
Thank you so much. Good morning to you, George Maringa. So today, the Novartis East African company has partnered with Kisumu County to launch the sickle cell disease management unit at Jaramogi Odinga Referral Hospital. And this is just one of the initiatives to ensure that, this county is able to deal with these issues, because sickle cell is a blood disorder and it is affecting a high number of children in, Kisumu County and also other counties. So about 15 counties have been earmarked for this first phase of the project, which include Nairobi County, Homa Bay, Bungoma, and many other counties. So this is just one of the projects that will help, deal with this issue that is currently affecting many children in our country. And, this is a disease whereby if it is not dealt with in the early stages of life, then children do not end up surviving beyond 5 years of age. So it is quite important to deal with it.
And sickle cell has been quite, families or other couples that want to get into the family way have been advised to seek medical advice to check of traces of sickle cell to avoid putting their children at risk. Absolutely. How much of appreciation is this, or rather how has it been appreciated in couples or in Kenyans? Are they coming out to just be checked, and perhaps would this launch be a step in towards that direction?
All right, so absolutely. It's quite interesting and intriguing about love matters, because when people fall in love and they come together, issues about health don't really come out during the first stages. So until when you have a baby, that's when you realize, okay, these are some of the things we should have looked into before we started, this courtship. But right now it is quite, the awareness is out there, and people are being encouraged, before you settle down, try and analyze with your partner, how safe are you, or, are you a carrier? Are you safe? Just to be able to look forward and, even prepare early enough, so that in case if you have children who have sickle cell, you know how to deal with them. Because sometimes sickle cell tends to be genetic, so it ends up coming generation after generation. So you find that there are couples who have really suffered. You have 5 to 8 children who have sickle cell, and majority of them don't survive. In fact, we did a story last month just surrounding sickle cell, and one lady talked to us about, she got 8 children, and only 3 of them ended up surviving. So this is one of the issues that we are encouraging, even as reporters. We're encouraging couples to check your status before you decide to go into the family unit.
Indeed, and I'm looking at a report here because earlier on we were reporting about the Nigeria being on the red list and of course this is in line with the updates from the health desk. Of course, you're monitoring this for us. The Omicron variant, Nigeria is on the red list on some of the countries banned from entering the UK, and the Nigeria High Commission, of course, has protested against this move. Where is the Omicron variant, where has it been reported so far, and perhaps any intervention, if you have been able to gather anything to deal with either the vaccines or even other interventions?
All right, so far Omicron variant has been detected in over 36 countries. This is globally. Here in Africa, it's still quite rampant within the South African region, with South Africa, recording a high number of the cases. But, the latest research or the latest data has shown that even though, yes, the number of cases are a bit increasing, there is no cause of concern, because the number of deaths has not increased in South Africa. So maybe this is why one of the reasons why African countries are lamenting over the results from other richer countries, like UK, who are really taking this a little high notch by restricting movement, restricting flights into some of these countries. A country like Japan, Morocco, has blocked entry of foreigners into the country. So this is some of the measures that, the World Health Organization is, telling countries, do not rush to do this, because at the end of the day, these variants have been recorded in these richer nations, these countries that have high number of vaccines, but, not a lot of, hard measures have been put against these countries compared to what has been done to African countries. But then maybe just to take it a notch further is, as a country, Kenya, we received about 4.6 million vaccines yesterday. This were from Germany. So 4.2 is Johnson & Johnson, and 0.4 million is AstraZeneca. So we can see that this is some of the measures that the Kenyan government is putting to ensure that, we protect ourselves, and we also hit the 10 million target, which was set by the Ministry of Health and also the national government in general.
Sada, you talk about the vaccines that are still coming in. So far, then the latest consignment is 4.6 million vaccines. The government is calling upon Kenyans to come out and be vaccinated. Perhaps are the numbers still low in terms of vaccine uptake? Where are we so far? Because that is quite something that has not been focused on lately or given so much limelight so far. But what are the numbers, if you've been able to gather anything to deal with the vaccine uptake in the country so far?
All right, so as of yesterday, we had a total of 7.5 million Kenyans who have received their vaccines. This can be either first dose or, second dose. I would say this is an increase compared to last week, around Wednesday, when we were at about 6.5 million, people who have received their vaccines. So we can say there's an increase over time compared to last week. And right now, we are still waiting to see if by the time we hit December 31st, we will have surpass the 10 million target. And also, worldwide, the World Health Organization is calling for countries to at least reach the 10 million, 10% of having their populations vaccinated. So it is quite an interesting period. The Ministry of Health is really rallying for many Kenyans to get vaccinated. Among Kenyans, we have people who are still questioning, are these vaccines safe? Are they effective? Why are we hurrying to, get such vaccines? But, so far from the research, we know that the vaccines are safe. But still, it is something that we are looking out to see if Kenyans will turn up, but so far we see we've hit 7.5 million people who have received the vaccines, and so far as a country we have 17 million vaccines that we have received as a country.
Indeed, of course, there is so much coming in from the health desk, and we will be conversing much more about the various inventions, including that Apple Watch invention. We will talk about that later. But before then, I've been speaking to Sada Hassan, our health and science reporter right here in studio.